What's up, guy? Your boy Wale this morning here. I'm here at LDN Physio inside One London, one of my favourite gyms in London. I'm here today to oversee my shoulder, well, not oversee, to go and get some treatment on my shoulders post-operation that I had almost a year ago. There's a little bit of atrophy on this side, and I've got the magical
Daniel Griffin. How you doing, guys? So Daniel's my name. I'm a sports physiotherapist with LDN Physio. We're having a look at the shoulder today, kind of going into the past and seeing, what happened and getting some objective testing, and just get to know each other and see how we can, help Wale.
Guys, you know me, I'm not an expert in everything, so one of the biggest advice I can give you all is if you are injured, make sure you see a physio and make sure the physio is reputable physio that you're seeing. I've always believed in reputable people. I'm not saying all physios out there are not reputable, but I love recommendations. I was recommended that, and I'm going to make sure that we get good content out of this as well. Stay tuned, see what we do. Let's go.
So tell me, just bring me back to when it happened and what happened around this time last year.
So for me, I was over in Dubai in 2024 at the end of October, and I was actually just struggling to move my arm. I wasn't 100% sure what I did, but obviously coming back to the UK around November time, I had an MRI scan done, and I was told I had a slap tear in my bicep tendon and a rotator cuff damage. But I think a lot of the stuff that I had through the MRI scan that I had done was misdiagnosed, because when they went in there to do the operation itself, they didn't find a slap tear on the bicep tendon, nor did they find rotator. Well, there was a little bit of damage to the rotator cuff, but it wasn't significant enough for them to operate on. So all they did for me initially was a cleanup of the rotator cuff tendon, they sort of shaved up some bones and basically allowed it to move well. Okay. The damage for the rotator cuff was not significant enough for the doctor to operate. But what they think is that what I had was some form of a viral infection or something that attacked the nerve. So I'm not like I said to you, the operation did set me back a little bit, obviously. But what I'm trying to gather from this is just to get that strength back in the arm and see where we can go from there.
What I'm really interested by is that, so you went to go see a consultant, I imagine, first, was it, to get the MRI?
That's correct, yeah. I saw a consultant.
And on the MRI, they confirmed you had a slap tear. Do you remember if it was a partial rotator cuff tear or a full rotator cuff tear? Partial.
Yeah, so...
But when they went in orthoscopically in the surgery, that wasn't the case.
Exactly.
Interesting. So it was basically a negative... It was a false positive, we would say. I haven't heard of that happening too often, because the MRI is the gold standard for shoulder imaging. But so they went in and they just did a cleanup. Just did a cleanup, and they actually think that the pain you were getting in your shoulder and the atrophy was because of a viral infection. Is that right?
Correct, yeah.
Okay. So what symptoms were you getting that kind of led you to getting viewed by a consultant?
So for me, I basically couldn't move my arm no higher than this. And when I couldn't move my arm, I was obviously I'm an operational firefighter for the past 25 or 26 years, and came back and I couldn't move my arm. My arm literally couldn't go any further than this.
Did that come on gradually, or did that just kind of...
It was all of a sudden, but...
no gym injury?
No gym injury. There's no mechanism of injury whatsoever. So that was all of a sudden that occurred. And for me, I was like, okay, well, what have I done? What do I do to repair it? I didn't really know what to do. So I kind of went straight to A&E. So I went to Charing Cross Hospital, I had numerous blood tests. There was nothing coming up significant enough. But what they think has happened, which is very unusual, is some form of a viral infection that attacked the nerve. And that's one of the reasons what stopped it from moving. But obviously, I thought it was obviously the diagnostic test that was done by the MRI is what I thought I initially done. And so, but as you can see, like I said, it's just coming here today for me is probably to work on more sort of rejuvenating the nerve around that sort of shoulder injury, and actually getting some movement back into it and doing some significant tests that we can do to get that sort of nerve around the shoulders and biceps resolved.
We need to know where you are
to
make a plan, and then to kind of reevaluate and see if our treatment has been effective, basically. Tell me what rehab looked like, because obviously you know your way around the body. You know, you're in great shape, and you're a competitive bodybuilder and a fireman. So those things, you've got back to doing all those things. But walk me through what your rehab looked like, you know, after February 2025, and where you are right now, before we just to know where you are before we go to the next level.
So my rehab prior to, obviously, you know, after the operation that I had, was very basics really. Is about just getting like continuous movement in that arm, still doing my sort of training around it, but basically when I mean still doing my training, so my program remained the same, but I use more machine based rather than dumbbells. An example would be, instead of doing a dumbbell incline press or dumbbell flat press on the bench, an incline press machine, flat seated press machine as well. So a lot more machine based training and less dumbbells, less barbells. So I didn't use a lot of the barbells. I did use the Smith machine a lot, and I found it quite useful and helpful because it was quite push evenly through the Smith machine because of the line of the plane of motion, line of motion, shall I say. But yeah, the Smith machine was helpful. Focusing on that sort of movement. As you can see, like my limited range of movement.
Do you feel limited?
Yeah, I feel like it's like it's jammed, you know.
No, this is all really good stuff.
This is good, guys. You're missing out. Come and see this guy if you need any physiotherapy, honestly.
So, in just kind of touching on your health in general at the moment, other than this, because this is quite a, you know, a big event, you know, someone like you so active, this probably kind of, you know, took the wind out of your sails for a little bit. How's your health at the moment in general, you know?
So my general health and well-being is something that I'm very big on. So obviously, like, having numerous blood tests done, I noticed like some like kidney enzymes and liver enzymes were relatively high. So, you know, that's just, you know, creatine level was high, CK was high. You know, I have regular blood tests done, and I donate blood every 3 months as well. But general health as a whole, I obviously working night shift, I do feel lethargic and tired from time to time, and so it's very hard to gauge. But overall, I'm a healthy 45-year-old man.
Tell me about your sleep. Are you getting any problems with your shoulder when you're sleeping?
So when it comes to sleeping, I wear the Whoop. Not that I'm sponsored by Whoop or monitoring or trying to give them credit, but I always kind of look at the data from that. And I'll be honest with you, I used to be a really good morning person, getting up in the morning, getting my workout done. Lately, in the last sort of 3 to 4 months, I've been struggling, and I don't know if it's kind of a change in sort of injury protocol, shoulders, but you know, something that I've been struggling with. So sleeping, I probably get up once or twice in the middle of the night to go pee, and then shoulders, sometimes I get that numb feeling in the middle of the night, which then wakes me up. So sleep hasn't been great for the last probably 3 to 4 months, to be honest with you.
You know, when sleep gets affected, it has a trickle-down effect on overall health. And you're already kind of like slightly in a risk group, being a fireman, doing night shifts, so like sleep hygiene is super important. Do you take any medication to mask those symptoms?
No, nothing at the moment. So when it comes to medications, the only thing I do take occasionally, which I have taken this week so far, is a bit of ibuprofen and paracetamol. Try my best not to minimize the amount of ibuprofen that I'm taking, but I take it maybe, you know, 2-3 days of taking it, and then I stop.
Okay.
Do you know what I mean?
Yeah, and is that every week or every month you find yourself doing that?
At the moment, I'm not taking on a regular basis. You know, I'm not taking on a regular basis. So this week so far, I've probably used ibuprofen over the weekend because I found my shoulder was actually aching a lot more. And I couldn't help that I injured my glutes a little bit doing hip thrust. Trying to get bigger bum, girls. So I injured my glutes a little bit, so that's been kind of achy a little bit. It's like an incision point where the glutes hamstring inserted into the glute area. I think I've pulled that. I've irritated the tendon. Yeah, I've irritated that. So
anything that specifically is you struggle with, anything you're like, I do not like doing these things because they bring on my symptoms.
To be honest with you, no. There's nothing specifically that I struggle with, even post-op. I try everything, even like I'm not a massive like barbell bench press. You know, obviously, you know, after having shoulder injuries, the most common injury that you have in the barbell bench press, shoulder injuries. You know, so I've tried, sometimes I use the gym at work and I'll do a barbell bench press. I'll try an incline bench press with a bar, with a dumbbell, again, flat dumbbell press with a dumbbell. So it's almost like, where's the limit? Try and error kind of thing.
Optimize your shoulder resilience, basically. Trying to make the shoulder more resilient. Basically, trying to improve your prehab or your preventative work.
Exactly that.
Yeah.
So for me right now, it's about getting myself, understanding where I'm at with my shoulder. I'd love to step back on stage. Reality of it is, I would love to get back on stage at some point this year. And I obviously love your support on that road to stage, because obviously as an IFBB Pro, I love competing and I want to compete at some point this year.
The consultant or the neurosurgeon is correct in the sense that nerve healing can take up to 2 years. It can take significantly longer than muscle, but everything you're doing by training is helping it. You know, it's bringing blood to the area, it's moving the nerve. That's all very positive. I think some of your symptoms that you're getting in the gym are more attached to your labrum and maybe some instability in the shoulder. So things like the rotator cuff may not be strong enough, or maybe don't have we call it rate of force development, which means basically it's not kicking in.
Yeah.
You're not getting to the strength that you need to use quick enough.
Yeah.
You know, it's kind of slow to get there, and that's probably definitely because that's called a neurological process, you know. No, I've gotten everything I want there now, so we'll move on to the physical assessment.
I love it. Guys, sorry for boring you, but that's very important that we do that talk.
So, show me exactly where you're getting that numbness.
Exactly where your finger was right there, where the numbness coming through. So it's coming through my shoulder, through the front and the side.
Right here.
Yeah.
And anything onto the side here?
So not so much. It's like almost like a little bit of the actual numbness itself. It's like all over the shoulder. Not targeted at any specific area.
The back as well?
A little bit of the back, you know.
It does sound like it's the axillary nerve.
Okay.
So that nerve, sometimes they call it the sergeant's badge, where you have it on the side here.
Yes.
Like you said, the viral infection may have been the cause of that inflammation to the nerve, and that it kind of innervates the deltoid. There is the nerve root, but you're not getting any kind of neck symptoms, anything like that?
Funny you should say that, actually, because I am now feeling a little bit of tightness along my neck. So when I turn to the left, I'm feeling tightness along the sort of going into the trapezius. Yeah. On the left hand side when I turn to the left, and when I turn to the right, I'm feeling a little bit of restriction on the right.
On the right,
and a little bit of tightness coming across.
So that can obviously restrict your range of motion, but you're quite built in that area.
Yeah.
Sometimes because the nerves obviously originate in the spinal cord, come out the neck, run into the deltoid and down the arm. Yeah. If there's a problem centrally, you might be getting downstream effects here. Yeah. So we'll do a couple of tests to kind of clear your neck, we would say. Yeah. With all shoulder conditions, you want to clear the cervical spine. Yeah. And that's more for my confidence to make sure it's nothing serious. Okay. And we'll move on to some sensation testing then, range of motion, and then we'll do the strength stuff.
Perfect.
Okay? Cool. So just look to the left again for me. Is that as far as you can go, you feel?
I can go a little bit further, but I feel like a lot of tension.
Yeah. Do you mind if I just put my hand here?
Yeah.
Yeah, and I'm just going to see if you can go a bit further. How does that feel?
Yeah, again, a little bit of pulling. I'm getting a little bit of pulling in this area here.
This area here. Yeah. Now, what I'm looking for in particular is if it brings on your numbness. Yeah. Okay, so other symptoms are important, but it's that numbness and pain that you're familiar with. Okay? Yeah. And you can go to the other side for me. And do the same again. How are you doing there?
Yeah, that feels fine. It's not a problem, but again, there's a little bit of tension across the shoulders there.
Yeah. If I actually just look straight up, how does that feel?
Yeah, a little bit of tightness along the sort of area.
Back here.
Yeah.
Can you go a bit further for me? Good. And if I just put a bit of overpressure here, how are you doing?
Yeah, again, a little bit of tension being built up on that back of the neck.
Back of the neck.
Yeah.
Nothing going down the shoulder.
Nothing going down the shoulder, no.
Okay, what I'm going to do now is I'm just going to do a little bit of a press down. That's basically going to close the space in between your facet joints. Yeah. It's going to be a slight push, nothing hectic, okay? Okay. I just want to see if it brings on any of your symptoms, okay? But it's nothing to be worried about, okay? Good. So I'm going to go in 3, 2, 1. Anything there?
Nothing.
No?
Nothing whatsoever.
If I ask you to go into this way and then rotate that way for me, just look up. Anything there?
Nothing.
If I push down. You okay?
Yeah, that's fine. No strain, nothing.
Good. And then if I ask you to look up and look that way for me, and I push down. Anything there?
A little bit of tension along the sort of radiating across the side of the neck, but nothing major.
Nothing.
Nothing. Like scale of 1 to 10, probably about 3.
Yeah, but you're not getting any ear numbness, any tingling
Nothing.
down the arm.
Nothing.
Good. Yeah. So that what's coming from here just sounds like a build-up of upper trapezius, usually because the lower trapezius is a bit weaker.
Yeah.
Because of the postures we all have with, desk jobs, but that doesn't really apply to you as much.
Yeah.
So what I was looking for, I didn't see it there. So
Yeah.
it would be a negative.
That's good.
Which is good. All negatives are good. So let's have a look now more at the shoulder. So I'm just going to run my hands down both sides and see if it feels any different. So I just, if you can see, just close your eyes for me. Any difference in feeling there?
No, the sensation feels similar.
Good. Here?
No, the sensation feels similar as well. Yeah, the sensation feels similar.
Good. Here?
The sensation feels similar again. Sensation feels similar. Yeah, sensation feels similar.
Anything there?
Sensation feels similar as well.
Here?
Sensation feels similar as well.
Just turn your hands out for me. There?
Yeah, sensation feels similar.
Excellent. Good. Okay. Good. So it sounds like you're getting your numbness after a particular session.
Yeah.
It's not there in sitting, is it?
No.
No. And when you adopt certain postures at work or in your daily life, does it bring on that?
Nothing.
Yeah, so it sounds like you're getting intermittent numbness.
Yeah.
And that's kind of in line with the nerve healing.
Okay.
Sometimes your symptoms will come on intermittently. Maybe there's some slight inflammation within the nerve, but as it's recovering, we'll hope to see that numbness episodes are reducing. Relax there.
Yeah.
What I'm going to do is I'm going to push basically your upper arm bone, your fingers into the socket, into the glenoid cavity.
Yeah.
And just see how's that feel.
Feels okay. There's no discomfort or anything.
That feel okay?
Yeah, it feels okay. There's no discomfort.
No clicking, anything like that.
No, there's no clicking.
Good. Let's have a look at this side. How does that feel?
Yeah, it feels okay. No clicking symptoms.
No.
Just a little bit of a pull, a little bit of tension. Again, the tension is radiating through to this trapezius.
Yeah. So again, I was looking for the clicking and the catching of the labrum.
Yeah.
You're not getting any of that.
No,
That's
no.
really good. Let's have a look at your range of motion. So if I ask you to pull down.
Yeah, it feels good. Like I said, there's a lot of tension in the upper sort of trapezius area when I'm trying to do that. And then when I do this, I feel a little bit of tension in the upper pecs. Is that quite normal?
So, I think what you have some, what we would say, kind of adaptive shortening
Yeah.
here in the front of the shoulder.
Okay.
Post surgery.
Okay.
And it's probably limiting you going into external rotation.
Yeah.
Pain?
Yeah.
Where are you getting your pain?
A little bit around the shoulder.
Around the shoulder.
Around the delts.
Yeah. So you don't need an excessive range of motion for your sport.
Yeah.
But getting the shoulder feeling better by giving you some external rotation drills.
Yeah.
Probably would be good.
Yeah.
Okay?
Yeah, that shoulder's limited range of movement.
Yeah. What we'll do is we're going to get a number for that.
Yeah.
And we'll see exactly where you are. Okay guys, so what we're using here is VAL. I suppose it's the gold standard really when it comes to objective testing in sports medicine or physical therapy. We're going to use it to gather some range of motion data. So what we're going to do is, what I want you to do as much as you can, if you can bend both knees for me, so that you don't compensate.
Okay, yeah.
And I'm almost going to take this away as well, so I can try and set the test up as clean as possible. And I just want you to go back as far as you can while keeping this down. Come back. One more time.
Good.
Yeah.
I feel like this when you was talking me through the actual movement itself.
Yeah.
And when you were saying good, I was literally just going as far as I can go there.
Yeah.
Obviously, that you can see definitely there is a little bit of limitation in the shoulder as well, post-op, and obviously the tightness of the chest is something I really want to work on because I'm scared of like tearing a pec or something.
Right, yeah. So,
It's really big, good bit of kit.
Yeah, we're gonna even do more with it in a second now.
Yeah.
So what we can see here from actually some of these reps there. So interesting enough, you're actually quite symmetrical.
Oh wow.
Yeah, I think what you're suffering from is feeling unstable.
Yes.
When you're going back.
Yes.
Yeah. So symmetry-wise, I think that the range of motion reduction you may have is more basically from your sport.
Okay.
But from a range of motion point of view, you've got good active range of motion.
Yeah.
It's that when that head of the humerus is coming forward, the front is coming forward. When you're getting to the end ranges, you're just not feeling confident.
No.
So we're gonna kind of go outside, get you hooked up to a piece of kit, and we're gonna get some exactly see how strong the shoulder is.
Okay.
Sound okay?
Let's do it.
Let's do it. So this is the objective testing basically working in external rotation. So we're trying to see the peak force. So what's the maximum amount of force we can put through the shoulder in this position, and the speed at which we can get to that, so RFD. So very commonly in athletes who have been kind of rehabbing for a while, their peak force is pretty good, especially with their dominance line, but that RFD, that rate of force development, the rate in which they can get to their peak force is lagging behind. And there's some evidence to show that can kind of leave you susceptible to some injuries. So what we're going to do is, I'm going to ask you just to scooch over slightly to the side and just get comfortable in this position. So just do 70% on the tension for me. Good. And relax. You feel okay?
Yeah, feels fine.
And go again for me. Good. So just a little bit higher, so we want no slack in the band. And go again for me. Good. And relax. Good. Feel pretty confident that you could do 3 maximum attempts?
Yeah.
Sweet. Okay. So what I'm going to ask you to do is just take up the slack. Good. Okay. And I'm going to give you as much encouragement as I can. Okay. 3, 2, 1, go. Come on. Go. Relax. Good. Okay. Catch your breath. Good. Okay. We'll go again now. Just take up the slack. Good. And go. Push. And relax. Good. So I'm encouraging you because that's the protocol. You have to give the athlete as much encouragement as possible. Okay. Good. Any pain?
No pain.
Good. Okay. Just take up the slack. Good. And go again for me. Go. Push. And relax. Well done. Okay. How did that feel?
The best one.
Yeah. Good. And relax. Good. Okay. What we'll do is we'll now check the other side and see how you're doing. Okay. Sweet. Okay. So our best result there was 112. 112. So 112 Newton force. Okay. What I get you to do for me now is just do those 70% again. So good. That's it. Just out here. Perfect. Good. How does that feel? Good. And relax. And we'll go again. Good. And relax. Okay, try an 80% for me now. OCD now. All right. Okay, 3, 2, 1, go. Push. And relax. Take up the slack. Good. 3, 2, 1, go. Push. Pull. Nice. And relax. Well done. Okay, last one. Take up the slack again for me. Good. 3, 2, 1, go. And nice. Well done. Excellent. Good. So results-wise, this side is definitely stronger. Yeah. Not a huge amount, but considering it's your non-dominant side, how did it feel when we were doing the testing?
I feel this side felt more comfortable. This side felt a little bit of tension in the delts.
Right.
So I felt like, I don't know, there's a little bit of an aching pain in the left, on the right, and the left-hand side delt.
I see. Yeah.
but I didn't feel any aching pain in the right hand side delts when I was doing it.
Okay, good,
You
good,
know, I
good.
don't know if it's because I just had that a bit more sort of in that position a bit longer.
Yeah, yeah.
But overall, like, you know, it's an interesting test.
Right, yeah,
It's an
yeah,
interesting
yeah.
test.
It's good to get kind of like objective, clear data, you
Yeah.
know, it's kind of like a third party almost, you know?
Exactly that.
So we've done external rotation, now we're going to do internal rotation.
Okay.
So we're going to kind of get you facing the mirror.
Perfect.
Great, good. So what I'm going to get you to do is just do some testing. So hand on your belly again for me. And camera on, yeah?
Yeah.
Yeah, sweet. So just want you to pull down slightly. How does that feel?
That feels good.
And relax. Go again for me. Good. One more time. Last one. Feel okay?
Yeah, feels good.
As much as you can, I want you to try to keep that shoulder high.
Okay.
Because what will happen is here, your lats will try to pull your arm down.
Okay.
Whereas I want your fist to rotate into the floor.
Okay.
That makes sense?
Yeah.
Good. Okay. Okay. 3, 2, 1, go, 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 and relax. Good. Strong here. 3, 2, 1, go, 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 go. Good. Last time. 3, 2, 1, go, 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 go. Excellent. Relax. You alright?
Yeah, good. Good.
Nice.
Really good. Really good.
Yeah, some good scores there. We got up to 186 newtons on the last one as well.
Oh, wow.
First one is usually quite good. Second one, fatigue comes in.
Yeah.
Third one, you kind of get that push.
Yeah.
Right? Sweet. Okay, last test. Left arm.
Yeah.
There you go. Give me 70%. Good, and relax. Then we'll go again. Nice, and relax. One more time. Good. Nice. Okay. Okay. Ready for last 3 big goes?
Yeah.
Okay. Sweet. So you're gonna grab on. Good. Okay. So 3, 2, 1, go! 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 And relax. Excellent. 3, 2, 1, go! 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 Relax. 3, 2, 1, go! 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 And relax. Well done. Nice work, man. You're finished. You're finished now. No more of that.
It's a lot harder than what it looks. Honestly, it's a lot harder than what it looks
Nice. So, do you want to go through some of the test results?
like. Yeah, go through it.
Right.
Go through it.
So, that test was actually the most surprising.
Yeah.
So, your left side
Yeah.
in internal rotation
Yeah.
was 14.3% greater.
Oh, wow.
So, your maximum force that you can produce
Yeah.
at internal rotation is 217 newtons on your left,
Yeah.
where it's only 186 newtons on your right.
Oh, wow.
That makes complete sense though,
Yeah.
because your anterior cuff,
Yeah.
your subscapularis,
Yeah.
and your bicep tendon
Yeah.
in the front of your shoulder
Yeah.
isn't engaging, isn't strong enough, doesn't have enough endurance
Yeah.
in comparison to this side.
Okay.
So what's really common nowadays is to be doing external rotation,
Yeah.
building with the back of the delt.
Yeah.
But you have to move into external rotation.
Yeah.
The stability comes from the front of the shoulder.
So from internal rotation.
Exactly. So building the front of the shoulder so that, because for you to move into a position,
Yeah.
it's got to be stabilizing off something.
Yeah.
And what can happen is, while you might be getting some of that clicking, some of that it doesn't want to press out,
Yeah.
is because basically what's happening, there's some slight instability in the front of your shoulder,
Yeah.
and that the head of the arm bone, the humerus, is gliding forward
Yeah.
because it isn't strong enough here.
Okay.
So what I would be prescribing for you
Yeah.
is some internal rotation
Oh,
stuff,
fantastic.
and we'll get on to that now.
Okay.
Sweet.
Fantastic. Guys, this is magic. Magic. That's all I can say.
Great stuff, guys. So we're going to be going through a anterior cuff subscapularis exercise. This exercise was shown to me by Ben Ashworth. He's a shoulder specialist, so due's given where it's due. I'll demonstrate it first, and then we'll go through it together. Okay, so what I'm going to get you to do is lie down in this position.
Yeah.
We were doing max force before.
Yeah.
I don't want you doing max force now because other things may kick in.
Yeah.
What I want you to do is I just want you to lie down like this in this position, 90 degrees shoulder, 90 degrees in my elbow, and I'm just pushing into the dumbbell, and I'll begin to feel this switch on.
Okay.
So I'm not giving max force, I'm giving around 80%.
Yeah.
Maintaining breathing, so I'm not bracing and compensating with something else.
Yeah.
I can feel it in me now already. Starting to shake a bit, and then relax. So usually what I prescribe is around 10 seconds on, 10 seconds off by 10 sets.
Yeah.
Or 15 seconds on, 15 seconds on by 6 sets. So just building up really good time under tension in the anterior shoulder, so you've got the stability to move from there.
Okay.
Will we try it?
Yeah, yeah,
okay.
Definitely.
So you can get there comfortably, can you?
Yeah.
Good. So I want you to keep that wrist in neutral. Nice. Okay. The muscles in here, it starts on the front side of the scapula, so you should feel a kind of a deep engagement, okay? Not through the chest, not through the lat. So just begin to push into the dumbbell. Nice. You okay?
Yeah.
Breathe through this now. This is like yoga, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Felt okay?
Yeah.
Good. Did you feel a kind of a deep contraction?
Yeah.
Good. So again, 7 out of 10, not max force. Okay, we'll go again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Good. So what I'd be saying is doing this, seamlessly integrating it into your routine to 2 to 3 times a week to build up the stability in the anterior shoulder, because we don't want any instability. We don't want the head of the humerus moving forward or backwards. So don't neglect your internal rotation strength. Any questions, my man?
No questions. All I can say is that I definitely feel the difference in the exercises that you've given me with that. I've never done that before.
Yeah.
It's something that I thought you were going to give me some resistant band for kind of internal rotations, or excuse me.
Yeah.
But this is definitely something I'll definitely add to my exercise program, which is quite easy to actually utilize as a warm up.
Exactly. And your core will feel great after.
Yeah.
There's nothing wrong with the banded exercises and stuff, but you're already doing a lot of that.
Yeah.
These are just some exercises that kind of like the shoulder specialists in the world are giving to their athletes.
Yeah.
We can kind of get too tunnel visioned in external rotation or or cables and stuff, but actually utilizing isometrics or eccentrics, putting ourselves into really kind of, you could say this is a vulnerable position. We're all quite confident down here,
Exactly.
but can you get out there and produce force?
Yeah.
That's really important, particularly for you when you're overhead pressing or bench pressing. So what I would be really interested in doing is giving you this exercise, 10 seconds on, 10 seconds off with an interval timer.
Yeah.
Like we were saying, 7 out of 10 contraction.
Yeah.
Doing that 2 to 3 times a week, and then coming back in 4 weeks' time,
Yeah.
and we'll see if we're better here.
Yeah, definitely.
Okay?
Definitely, I agree.
Nice, man.
Thank you very much.
No worries, brother.
Thank you very much. Thank you.
Okay.
Let me give this a... Guys, as you can see here, I've been working with Dan today over at LDN Physio. Fantastic guy. A lot of stuff I've learned, a lot of stuff I've done. That's very first time. I haven't done this exercise before my whole entire life for lifting. Whenever you need any help, any assistance, check out LDN Physio and ask for Dan.
Thanks very much, guys.
Let's get a pic. Thank you very much,
No
man.
worries,
Thank
brother.
you.
Yeah,
Thank
no
you.
stress.
Thank you.